Hello. In today's presentation, we will discuss an important topic on patient safety and interprofessional collaboration. This topic is crucial in healthcare because preventable errors persist due to poor communication and coordination. Hierarchical cultures discourage staff from speaking up, and inconsistent safety rules and inadequate training worsen the issue. Collaboration among healthcare professionals is vital. It fosters clear communication, unifies teams, and blends diverse skills to reduce risk and ensure high quality care. Patient safety is a top priority in healthcare. Here are the main objectives of this presentation. 1. Understand importance of teamwork and communication for patient safety. 2. Explain key skills for collaboration. 3. Describe impact of interprofessional interventions. 4. Look at examples of successful interprofessional interventions. And 5. Evaluate different methods to measure successful interventions.
Medical errors are defined as unintended acts, failures in plans of action, or deviations in care and healthcare delivery that can harm patients. Harm to the patient could occur at the individual or system level. According to a BMJ study, medical errors are the third leading cause of death in the United States. Medical errors can be separated into multiple categories. Diagnostic errors, treatment errors, preventative errors, and communication errors are some of the most common types of errors. Diagnostic errors are mistakes in determining what's wrong with a patient. These errors can occur during the initial collection of patient history and symptoms if information is incomplete or miscommunicated. Treatment errors occur during the administration of care or therapy intended to improve a patient's health. These can lead to serious consequences and can occur at a wide range of patient facilities. Preventative errors refer to mistakes that occur as a result of failure to implement measures that could have prevented harm to the patient. These errors can occur as a result of failed or flawed processes, systems, or practices meant to avoid risk. Communication is the common denominator of medical errors, and it can occur at each level where there are failures in communication between staff. Root cause analysis is a step-by-step process used to identify underlying causes of sentinel events or adverse events in healthcare. The first step is data collection, in which professionals are brought together from a variety of different disciplines to offer their unique experience and expertise on a situation. The data is analyzed for patterns, trends, and potential root causes of the problem. The next step is causal charting of errors, in which interdisciplinary teams analyze factors contributing to the event from various angles. The sequence of events leading to the sentinel event is analyzed at each step, identifying possible errors or deviations at each step of the process. Following causal charting, the interprofessional teams attempt to identify the root cause. This is ultimately the underlying factor or factors, if adjusted, could prevent similar sentinel events from occurring again in the future. Recommendations for preventive action is the next step after the comprehensive analysis. These suggestions need to be specific, able to be brought forth into action, and aimed at addressing the root causes found in the previous step. The final step is implementing these recommendations and monitoring their effectiveness. RCA2 has been recently created, emphasizing action to prevent harm. Framework for Care Transition Model is a recent team-based strategy designed to improve handoffs. The inputs into the model include the environment, which includes external factors like noise, physical space, and interruptions, which can affect handoffs. Organization refers to policies, leadership, staffing, and resources, which can affect inclusivity and efficiency. EMRs and handoff checklists or protocols like SBAR can enhance or hinder the handoff process, depending on their integration and usability. Mediators, such as communication, leadership, and coordination, serve as intermediaries between inputs and outputs. Communication is essential for passing patient-specific information and preventing errors. Leadership guides team performance and influences dynamics. Coordination is defined as orchestrating the sequence and timing of interdependent actions to achieve goals in a collaborative team, leading to improved patient safety. Patient outputs affect the individual, the patient providers, team, and organization. Patient outcomes involve health status, care, quality, and satisfaction, while provider outcomes include stress levels, job satisfaction, and legal ramifications. Organizational outcomes encompass Financial, regulatory, and cultural factors. Team adaptation exists where outputs influence future performance development, leading to iterative improvement. Adaptation takes place at each stage, the input, mediator, and output steps, and is essential for growth and development.
Interprofessional collaboration is often defined within healthcare as an effective and ongoing partnership between professionals from diverse backgrounds with distinctive professional cultures and possibly representing different organizations or sectors working together in providing services for the benefit of healthcare users. There are two components regarding interprofessional collaboration, the first being interprofessional. Interprofessional implies that patient care incorporates diverse perspectives and opinions from members of all professionals involved in patient care. Collaboration implies that patient care is delivered in a smooth and timely manner while working both as a team and on individual tasks to provide optimal patient care. In regards to the benefits of interprofessional collaboration, collaboration in healthcare has been shown to improve patient outcomes, such as reducing preventable adverse drug reactions, decreasing morbidity and mortality rates, and optimizing medication dosages. However, not only does interprofessional collaboration benefit the patients involved, it has been also shown to benefit healthcare providers as well. For example, a key component of collaboration is teamwork. Through the use of teamwork, studies have shown that healthcare providers have a reduced workload as well as increased job satisfaction. Now that we know why interprofessional collaboration is important, how do we achieve it? Well, according to an article published in 2015 by Bosch and Mansell, there are 5 essential components for a healthcare team's success. These 5 elements include role clarity, trust and confidence, the ability to overcome adversity, the ability to overcome personal differences, and finally, collective leadership. IPEC has 4 core competencies. The first IPEC core competency is values and ethics. There are 11 sub-competency statements that fall directly into the category and are essential to being able to work with team members to maintain a climate of shared values, ethical conduct, and mutual respect. The second IPEC core competency is roles and responsibilities. There are 5 sub-competency statements that fall within the category that are required to use the knowledge of one's own role and team members' expertise to address individual and population health outcomes. The third core competency is communication. There are 7 subcategory statements that lay the foundation of the communication competency. The subcategories are essential for being able to communicate in a responsive, respectful, and compassionate manner with team members. The final core competency is teams and teamwork. There are 10 subcategory statements that make up the overarching competency of teams and teamwork. This competency requires team members to apply values and principles of the science of teamwork to adapt one's own role in a variety of team settings. SBAR is a tool that is used as follows. S is the situation. You state the problem. B is for background. You present relevant information associated with the problem at hand. A is for assessment. You consider various options. And R is for recommendation. You recommend a specific action. SBAR helps organize information and makes it easy to provide recommendations and feedback when discussing options with other members of the interdisciplinary team. Making it easier for team members to communicate openly with other professionals has a direct impact on patient safety as well. Open communication allows team members to gain confidence and comfort when speaking with other members of the healthcare team, which is essential for patient safety, especially during transitions in providing care. Another strategy used for effective communication are checklists. Multiple studies have shown that the use of team checklists is an efficient tool to help promote information exchange between team members. Checklist discussion providing detailed case-related information, confirmation of details, articulations of concerns, team building, education, and decision-making are only of the few optimal outcomes of using a team checklist. Although so many positives have been statistically proven when interprofessional collaboration is implemented in practice, there are many barriers in regards to interprofessional collaboration that must be addressed and considered before interprofessional collaboration is accepted in every healthcare setting worldwide. Some examples of these barriers include hierarchies and a lack of trust and mutual respect between team members. In regards to hierarchies, at the inter-individual level, the imbalance of power between professions is due to hierarchies between disciplines. Having tension between different professions due to hierarchies in the workplace create a significant barrier to achieving optimal interprofessional collaboration. To add on, looking back at the core competencies of IPEC, trust and mutual respect are essential components of IPEC's values. Trust and mutual respect are foundational aspects of achieving interprofessional collaboration in the workplace. Without trust and mutual respect, healthcare environments typically witness strained relationships across professions.
Moving on to interventions. An intervention can be a service, activity, tool, or strategy used to promote or enhance collaboration. Here we have 3 types of interventions. An educational intervention includes a curriculum with precise objectives and learning activities. For example, interactive meetings, workshops, or team-based simulation activities. Practice-level interventions include strategies and activities that can be implemented within the healthcare setting, such as team huddles, interprofessional rounds, team checklists, and collaborative planning. Lastly, organizational interventions involve transforming the healthcare environment by promoting collaboration through institutional policies, clinical guidelines, or workspace redesign. Here we have some examples of practice-level interventions. First, we have Team Steps, an evidence-based set of collaboration tools that aims to enhance patient outcomes by improving communication and collaborative skills among healthcare teams. Team Steps provides video simulation and in-person training focused on 5 fundamental principles: team structure, leadership, situation monitoring, mutual support, and communication. Next is SBAR, a communication strategy that can be implemented in any healthcare setting. As mentioned earlier, SBAR is short for situation, background, assessment, and recommendation. This strategy allows healthcare professionals to communicate critical information quickly and efficiently, leaving a small margin for error and minimizing the risk of miscommunication, which can harm the patient. Strategic interventions in the organizational context can significantly enhance an organization's capacity to support its teams. Teams require strong organizational support to operate effectively. A clear organizational mindset that values collaboration can encourage healthcare workers to work as a team by creating supportive environments with management structure, resources, information, education, feedback, and specialized assistance in team functioning. Organizational level strategies include workshops for organizational leaders, developing protocols and guidelines on roles and responsibilities, and strategic planning. Here we have a research study that shows the success of an interprofessional education program. This study examined the effects of implementing a patient safety learning initiative called SafetyNet at a Canadian hospital. It involved online modules, team-based training, action learning projects, and presentations. Healthcare professionals like nurses, physiotherapists, and dietitians participated. The study found that participants acquired patient safety competencies in an interprofessional setting, leading to perceived improvements in patient care and workflow. The findings encourage organizational leaders to provide opportunities for healthcare teams to engage in interprofessional teamwork and patient safety interventions to improve patient care. Next, we have another example of a successful educational program. This study investigated the usefulness of virtual simulation as a tool for interprofessional team training. Using computer technology, machine learning capability, and artificial intelligence, the researchers developed CyberPatient, a 3D virtual simulation emergency room prototype with 3D assets, interactive 3D avatars, 3D patients, and clinical cases. CyberPatient was created to help healthcare professionals practice communication skills in a clinical scenario. After each simulated clinical session, there was a debrief session. Overall, participants provided positive feedback on CyberPatient's usefulness as an effective tool to support team training in a simulated clinical environment.
A mixed methods approach offers researchers an opportunity to explore the overlap between qualitative and quantitative data sources. Qualitative data is that which can be observed. It is often subjective and cannot be quantified, such as methods of communication in interdisciplinary collaboration. Quantitative data is that which is presented mathematically. The data is objective and measurable, such as the mortality rate within a given hospital. Samples are often large and randomized and produce specific, accurate results. Mixed methods research helps to ensure the legitimacy of statistical results by capitalizing on the strengths and accounting for the weaknesses in qualitative and quantitative approaches. It introduces the concept of a third path, in which the mixed method study design offers a tertiary lens for the evaluation of the overlap between two different questions and perspectives. It's important that when implementing a mixed methods evaluation, the study is designed and executed in a way that protects and enhances the legitimacy of mixed methods research. Researchers should aim to produce data-driven results by using strategic integration to ensure that one type of data informs the other. An outcome measure is that which aims to assess the effectiveness of an intervention. It should seek to support the nature of the hypothesis and address the research question. When considering the impact of interdisciplinary collaboration on patient safety, there are a variety of categories of interest, which can help researchers determine if intercollaborative interventions have been successful in improving safety outcomes. Patient health and safety can be assessed by measuring aspects of patient care, such as rates of mortality and morbidity, recovery times, readmission rates, medication errors, infection rates, and adverse events. In addition to patient health and safety, interdisciplinary collaboration has the potential to impact other facets of healthcare, such as patient satisfaction and efficiency of care, professional outcomes, educational outcomes, community health and social services, and policy and program effectiveness. Each of these, while not direct measures of patient safety, have the ability to enhance healthcare delivery, which will ultimately impact the quality, efficiency, and safety of care. Quality of care and patient safety are directly dependent on effective teamwork and communication. The main source of patient harm is errors in communication and human failures. Interdisciplinary and interprofessional communication intervention, how psychological safety fosters communication and increases patient safety, by Detail et al. 2023, investigated mechanisms of an interpersonal team intervention which targeted communication. The relationship between psychological safety, patient safety, and team performance perception were examined based on the applied input-process-output model of team effectiveness. Results showed that perceived patient safety risks were lower following a 4-hour communication intervention for multidisciplinary teams, and highlights the importance of communication training.
Here is a brief summary. This presentation highlighted the need for teamwork to prevent medical errors and ensure patient safety. We examined the IPEC framework, tools like SBAR, checklists, and interventions like team training. Real-world examples show that mastering teamwork improves patient outcomes. Therefore, investing in collaboration pays off in today's complex healthcare system. Here are our recommendations to improving teamwork for patient safety, all requiring a multifaceted approach. 1. Start interprofessional education early. It will break down hierarchies. 2. Provide team-based training on tools like SBAR and checklists. 3. Cultivate a culture that values all voices and shared decisions. 4. Create frameworks to define and clarify roles and for conflict resolution. 5. Track efforts through rigorous program evaluation and patient outcomes. And finally, 6. Recognize and reward good teamwork. We hope you enjoyed our presentation. We highlighted how crucial teamwork is in preventing medical errors and keeping patients safe. We covered 3 main topics: effective communication, teamwork, and tools like SBAR and checklists. We also discussed strategies for improving teamwork and evaluating these efforts. And we shared real examples showing how teamwork positively impacts patient care. Thank you for listening.